Welcome to PharmD with the T. So I wanted to take some time out to explain why I started this particular channel. Some of you may already know I have another YouTube channel called MellyMel the Muse. But I started PharmD with the T for a very specific purpose. I'm a healthcare professional. I'm a practicing healthcare professional. More specifically, I am an inpatient pharmacist, which means I'm a pharmacist that works in a hospital setting. Throughout my education, my training, residency, the different settings that I've practiced in, gained experience in, the patients that I've met over the years, even my own interaction with friends and family, because when you're a healthcare provider, some of you healthcare providers will know, or even if you're like another sort of working professional, once you're that person in your family, you're the person that everybody goes to. You're the one that has knowledge that they want and need. And then I realized, I'm pretty sure there are other people out there that want that same knowledge. So I created this channel as a way to provide knowledge to the general public on topics that I think are important, no matter how small or large it may be. Some healthcare professionals and even some consumers out there may think that some of the information that I'm going to address is pretty straightforward or common sense, and I'm here to tell you that that may not be the case for certain things. There might be some people out there who have pretty good questions. They generally have a concern, and they might be too afraid to speak to a healthcare provider about it. Maybe they're afraid to speak to their pharmacist or their doctor or their nurse practitioner, whoever it is that you speak to. And I want to make sure you guys know that it's okay to discuss these things with your healthcare provider. Don't feel scared and don't feel ashamed either. Don't feel that you just come off looking like you're an idiot or that you're stupid. Like, how do you not know this? No one knows this until they learn it. Something that you may think is common sense is not, especially when it comes to health, when it comes to the healthcare system, when it comes to medicine. It's not common sense. It may feel that way to me because I understand it to a higher level, but it really isn't for most people. And ultimately, my goal is to make it a safer environment for consumers. I want to advocate for medication safety, for healthcare safety, for improved quality in the delivery of care to consumers, especially when it comes to underserved populations, vulnerable populations, pediatric populations or geriatric populations, or certain minority groups that are definitely underserved, such as African American women. The statistics can be staggering when you look at the health status of populations within this country. Especially being a world leader, you would think we would be doing better, and we're not. By no means am I saying that I am now your particular healthcare provider. I want to serve as a resource for people. In no way should my content replace you actually speaking to a medical professional that knows your case, that knows your medical history. Because another thing that I've learned practicing is that everyone's different. You have to literally personalize the care to meet the needs of that person. But I do want to be able to provide you with some information so that, maybe a light bulb will go off in your head, or maybe it'll help you or keep you from making a mistake or an error, or maybe it will prompt you to seek the advice and medical attention that you actually do need and maybe didn't think you did need. So I would like to address topics in healthcare. I want to promote medication safety. I want to promote quality care. Now, the information that I provide you should not be in place of you seeing a healthcare professional. If you have a serious issue or you think you might have an issue that needs to be addressed, I would highly encourage you seek out medical advice and attention. I highly suggest that you research your providers as well before meeting them. Given the experience that I have, the different caliber of individuals that I've met throughout my career, trust me, not everybody is made equal when it comes to being a healthcare provider. There are some damn good healthcare providers out there, but you're going to have to do your research, look at reviews. I really hope that the information I provide you on this channel empowers you, makes you feel like a more informed consumer when it comes to your healthcare, makes you feel more empowered and more in control and more confident about what it is that you're doing. And I also hope to provide you with knowledge so that you're better informed of what's going on in our healthcare system. You're better informed of your options. So as topics come up in my line of work or in the media or in my own life that I notice, like, you know what, this might be a good thing to discuss, I'm going to let you guys in on it, because I've gone through my fair share of experiences as a patient, as a consumer. I wasn't always a healthcare provider. I mean, that was part of the reason why I became a healthcare provider. Maybe I'll tell you that story one day. Thank you for taking the time out to watch this video.